Dear colleagues, I am happy to at least virtually be with you today, and I wish to thank Dr. Du for inviting me to give this keynote lecture at the Second International Summit Forum on Chinese and Western Medicine for Scoliosis. The title, How Idiopathic is Idiopathic Scoliosis, is an intriguing question that highlights the complexity and lack of understanding of this condition. Scoliosis is a medical condition characterized by an abnormal curvature of the spine, which may, in a minority of cases, result in pain, discomfort, and mobility issues. Idiopathic scoliosis is a subtype of scoliosis that occurs in children and adolescents without an apparent underlying cause. However, despite its name, idiopathic scoliosis may not be entirely idiopathic, as there may be underlying factors that contribute to its development. The question posed in the title reflects the ongoing debate among medical professionals regarding the true nature of idiopathic scoliosis. Some believe that it is truly an idiopathic condition with no known cause or predisposing factors. Others argue that there may be neuromuscular, genetic, environmental, or developmental factors that contribute to its development. It was found that there may be a genetic component to idiopathic scoliosis. Some authors identified several genetic variants that were associated with an increased risk of developing idiopathic scoliosis. This suggests that there may be an underlying genetic predisposition that contributes to the development of the condition. Other research has focused on environmental and developmental factors that may contribute to idiopathic scoliosis. For example, some studies have suggested that certain activities or postures, such as carrying a heavy backpack or sitting for long periods, may increase the risk of developing scoliosis. Additionally, some researchers have hypothesized that hormonal imbalances or abnormalities in the growth and development of the spine may play a role in the development of scoliosis. Overall, the question of how idiopathic scoliosis truly is remains a topic of ongoing research and debate. While there is still much to be learned about this condition, current research suggests that there may be underlying neuromuscular, genetic, environmental, and developmental factors that contribute to its development. Future research may shed more light on the true nature of idiopathic scoliosis and lead to more effective treatments and prevention strategies for this condition. However, more and more recent discoveries suggest that idiopathic scoliosis is caused by a functional tethering of the spinal cord. Since 1925, the publication of the book by Farkas, many papers followed supporting the concept that thoracic flatback appears first before lateral deviation and rotation appear. Somerville described thoracic idiopathic scoliosis as a combination of lordosis, axial rotation and lateral flexion, and suggested that the lordosis arises from a failure of growth of the posterior elements of the segment of the spine. Rowe further described this theory in 1966 and suggested that the fundamental problem in scoliosis is the relative lengthening of the anterior components of the spine compared to the posterior structures. This situation in a stiff anterior musculoskeletal wall could result in lateral deviation of the spine and the development of a scoliosis. The theory of ventral overgrowth culminated in the realization that functional tethering of the spinal cord is the basis of the excessive growth of the anterior column. Deng et al. In their MRI studies have identified and described this condition. There are therapeutic approaches that confirm the findings of functional tethering through their effectiveness. In her habilitation thesis, Tomaszewski was able to prove that treatment of the flat back deformity by means of manual therapy significantly favored the course of incipient idiopathic scoliosis. Our working group has elaborated an extracorporeal shockwave approach, as well as certain exercises to approach this condition. In a case report on the application of extracorporeal shockwaves in the treatment of scoliosis, it was concluded that the short-term effect of extracorporeal shockwave therapy was revealed in this study. The neural structures that inhibited free mobility of the spine were mobilized. Furthermore, deformity was reduced by applying extracorporeal shockwave therapy. In a case series of 15 girls with idiopathic scoliosis and with a cup angle between 20 and 50 degrees, it was concluded that the concept of a functional tethering of the spinal cord in patients with AIS, adolescent idiopathic scoliosis, is supported by the results from this investigation. The application of extracorporeal shockwave therapy in patients with AIS seem to have a beneficial influence on 3D deformity and the subjective feeling of a tense back. Now I would like to show you the technique of applying extracorporeal shockwave therapy to the thoracic spine in a patient with so-called idiopathic scoliosis. Tethering exercises have been developed as well in order to improve the condition derived from a Qigong protocol. Today we call these updated exercises Neuro-Qigong. Exercise number 1, starting in the long seat, to lift up on the internally rotated and stretched arms on the fist to fix the brachial plexus. The head is tilted to one side at a time and rotated to the opposite side. If the movement is familiar, then the head movement is performed in increasing cervical flexion to exert more traction on the spinal cord. Exercise number 2, starting position also in the long seat. The torso is turned to one side at a time with the nose turned furthest. If the movement sequence is familiar, then the head movement is performed in increasing cervical flexion in order to exert more traction on the spinal cord as well. Exercise number 3 is a little more complex. It is described in more detail in the course textbook Short Best Practice from our working group in a 3rd expanded edition. This exercise, as well as exercise number 4, are taken from the Qigong program published in the German book entitled Qigong, Exercises and Music, published in Pflaum Company, Munich, 1999. Stokes' visual cycle is a concept in the field of idiopathic scoliosis which refers to a self-perpetuating cycle of spinal deformation that can occur in individuals with this condition. The theory was first proposed by Dr. Ian Stokes, a researcher and orthopedic specialist who studied scoliosis extensively. According to the concept, the abnormal curvature of the spine in individuals with idiopathic scoliosis can cause a series of changes in the surrounding muscles, ligaments, and other tissues. These changes in turn can lead to further spinal deformation, creating a vicious cycle that perpetuates the condition. Spinal deformity leads to asymmetric loading of the spine. This leads to asymmetric growth and to wedging of the vertebrae and discs. The result is an increased spinal deformity. The Stokes vicious cycle is believed to involve several key factors, including spinal rotation, asymmetric loading, and altered neuromuscular control. As the spine becomes more curved, the muscles on one side of the body may become stretched and weakened, while those on the other side may become shortened and tight. This can lead to an imbalance in spinal loading and further deformation of the spine. In addition to the physical changes, the Stokes vicious cycle is thought to involve psychological factors as well. Individuals with scoliosis may experience anxiety, depression, and other emotional issues as a result of their condition, which can further impact their physical symptoms. While the Stokes vicious cycle is still a topic of ongoing research and debate in the field of scoliosis, it has helped to shed light on the complex interplay between physical and psychological factors in this condition. By understanding the various components of the cycle, researchers and clinicians may be able to develop more effective treatments for individuals with idiopathic scoliosis. Overall, the Stokes vicious cycle concept is a valuable contribution to our understanding of this challenging and often misunderstood condition. Slight asymmetries of the spine and asymmetric loads of the spine, however, are very common. One-sided shortening of the leg, asymmetric sports, or many more. Idiopathic scoliosis, on the other hand, which requires treatment, is a rare condition at about 0.5% of the total population. There must therefore be other factors besides asymmetrical axial load on the spine that leads to vast progression of the curvature. On the contrary, in one study it was demonstrated that the dosed axial load even favors curvature straightening in patients with low-grade scoliosis. This fact speaks against Stokes' theory. Progressive scoliosis has also been observed in marine mammals, completely without axial load, including whales, and can have a variety of causes and can affect the health and survival. Stranded whales with scoliosis may be at a higher risk of mortality due to the associated physical deformations and potential impacts on their swimming behavior. Another fact also speaks against Stokes' hypothesis. Idiopathic scoliosis of a lighter degree, for example 25 to 30 degrees and risk of 0 without treatment, are almost 100% progressive during the main pubertal growth spurt, while a congenital scoliosis of the same maturity and degree usually remains without progression and even without treatment. Here we have a patient with congenital scoliosis, left at the age of 10, middle left at the age of 12, and at the age of 14 years on the right, with a curve initially measured 26 degrees thoracic. A girl at the age of 10 with an idiopathic scoliosis at the same degree of curvature would have a calculated risk of more than 95% for being progressive. On this slide you can see the X-ray of the same patient at the age of 10, 12 and 14 years from left to right respectively. No progression has been found. Of the many different possible causes of idiopathic scoliosis mentioned in the scientific literature, most could also be a consequence of deformity. Nevertheless, it is exciting to see that new theories are published every year. Even the currently much discussed concept of decreased rotational stability is hardly substantiated. In view of the large number of papers supporting the concept of ventral overgrowth due to functional tethering of the spinal cord and the radiologically documented correlate that has been found, this concept must be given primacy in causal research. The good news is, whatever the underlying cause of idiopathic scoliosis may be, with optimum treatment at the right time, you can turn the vicious cycle into a virtuous cycle and straighten the scoliosis clinically as well as radiologically. You see a compliant patient treated with short best practice and a Gansingen brace with a clear clinical as well as radiological straightening 9 months after brace weaning, as documented by our friend Nikos Tournavitis from Greece. With my very best wishes to all of you, have a nice time.